By request, kick-ass facts, narcolepsy, and epilepsy. But pew, pew, pew! Narcolepsy affects an estimated 1 in every 2,000 people. It is estimated that only 25% of people who have narcolepsy have been diagnosed and are receiving treatment. I kind of feel like they pulled those numbers out of their asses a little bit, like estimated 1 in every, but only 25%. Symptoms of narcolepsy include excessive daytime sleepiness, sleep attacks, cataplexy, sleep paralysis, hallucinations, and disrupted nighttime sleep. Cataplexy is an episode in which strong emotion causes a sudden loss of muscle tone. It can be as extreme as a full-body collapse or less severe, such as slackjaw. Not everyone who has narcolepsy experiences cataplexy. Narcolepsy is diagnosed through a sleep study. The average time between the onset of symptoms and diagnosis is 7 years. Symptoms typically begin to occur between the ages of 10 and 30, although you can be diagnosed or experience it at any time. 60% of patients were misdiagnosed. The common misdiagnosis was depression, followed by insomnia and obstructive sleep apnea. Canines and rodents also experience narcolepsy. Narcolepsy causes sudden sleep attacks, which can be very dangerous while driving. Narcolepsy Today cites that narcoleptics experience 10 times more traffic accidents than people who do not suffer from the disorder. I mean, I don't want to be ableist. That's the last thing I want, but 10 times, that's a lot. That's a lot. Epilepsy is a disorder of the brain that causes seizures. There are many causes and many kinds of seizures. The way a seizure looks depends on the type of seizure the person is experiencing. Some seizures can look like a staring spell. Others cause a person to collapse, shake, and become unaware of what's going on around them. There are over 40 different types of seizure. Globally, about 65 million people live with epilepsy. 1 in 26 people will develop it in their lifetime. That's how you do stats. No estimate of a guesstimate. Some people are born with it. Some get a fever which affects their brains, while others develop epilepsy after a stroke or brain injury. Before modern medicine, cultures around the world mistook epileptic seizures for spiritual possession. There's even a passage in the New Testament of the Bible where Jesus performs an exorcism on a boy having an apparent epileptic seizure. The ancient Greeks believed seizures were a punishment sent from the gods and therefore considered them sacred. You cannot swallow your tongue during a seizure. You should never force something into the mouth of someone having a seizure. Do not restrain someone having a seizure. Clear the area so they don't get hurt. 30% of epilepsy patients cannot be treated with medication. Individuals who have drug-resistant epilepsy need to use different treatment options. A ketogenic diet has been shown to help. I'm not a doctor. I don't even play one on TV, so take that with a grain of salt. That's what I found online. Disclaimer. Seizures used to be called fits or attacks. Seizures can happen when there is a sudden interruption in the way the brain normally works. Women with epilepsy have more seizures during their period, and around 40% of men with epilepsy have a decrease in testosterone.